Hello and welcome to the Digitalization course, Digital Skills for Nurses by the European Federation of Nurses Associations. This course consists of 9 lessons, each approximately taking 10 minutes to complete. After each lesson, there's a quiz and you need to answer 19% of the questions correctly to proceed to the next lesson. Additional resources, including readings, links to supplementary learning materials, and relevant organizations, are accessible in the additional reading resource material. The 10 lessons will start by providing an introduction to the EU policy context on the digitalization healthcare systems and what digitalization encompasses. It will then delve deeper into digital health for nurses and what it represents for frontline healthcare professionals. Additionally, it will offer an overview on the collaboration, training, and student education to digitalize the healthcare ecosystems in the EU. This includes empowering citizens, patients, and healthcare professionals. We will also give you an overview on the digital health coach, resilience, and crisis management. Furthermore, we will explore quality assurance in the context of digital health nursing and examine its impact on the healthcare. We will address wider advocacy, cooperation, and communication concerning digital health. And finally, we will give you some examples of the digitalization healthcare systems in the EU. This course aims to help you understand the relevance on the digitalization healthcare systems in the EU, providing an overview on the digital health for nurses. It will equip you to assess and assure the quality of digital health nursing with examples on the digitalization healthcare systems in the EU. You will also learn how to empower both patients and fellow healthcare professionals. For in-depth materials, you can click on the section called Read More of this MOOC. Once again, welcome to the course, and let's begin with the first lesson of the Digital Skills for Nurses. The BeWell Project is an Erasmus 4-year EU project on digital skills in which DFN is a key partner. BeWell aims to form an alliance to build a movement for all healthcare stakeholders and is committed to the development, implementation, and upscaling of the strategy on upskilling and reskilling of the European health workforce. The ultimate project aim is to develop a green and digital skills strategy for the health ecosystem that can be implemented at local, regional, and national and ultimately at European level through the Pact for Skills in the context of the Blueprint for Sectoral Cooperation on Skills. In 2016, the European Commission expressed their interest and commitment in supporting the European workforce presenting the European Skills Agenda with the aim to tackle skills challenges. In that year, one of the key initiatives implemented was the Blueprint for Sectoral Cooperation on Skills. Under the blueprint, the relevant stakeholders form an alliance to develop and implement strategies to address skill gaps in their sector at national and regional level. In 2020, the European Commission developed the European Skills Agenda, which is a 5-year plan to help individuals and businesses to develop more and better skills for strengthening sustainable competitiveness, for ensuring social fairness, and for building resilience to react to crises based on the lesson learned during the COVID-19 pandemic. Moreover, the first flagship activity under the 2020 European Skills Agenda is the development of a sustainable cooperation and large-scale European partnership through the Pact for Skills to facilitate concrete actions toward the upskilling and reskilling of the European workforce in key industrial ecosystems. When we talk about digitalization and digital opportunities, the healthcare sector is still lagging behind, and nurses and healthcare workers don't have the knowledge and the skills necessary to be able to exploit digital tools and their advantage. For this reason, we suggest to focus on 8 competencies of the Directive 55 by addressing the existing skill mismatches and strengthening these competencies. In this regard, the BeWell project will enable frontline nurses the necessary skills to be better prepared for facing future challenges and for adapting to ever-evolving societal context. In the BeWell project, DFN is focusing on building comprehensive curricula and training programs that will target nursing students and frontline nurses. From an EFN perspective, it is essential to improve the digital skills of nursing workforce by ensuring that these skills are included in the core content of initial education as well as continuing professional development, reskilling and upskilling of healthcare professionals. The Nurses Directive 55, Article 31 defines 8 core competencies that nurses must possess. Throughout this course, we will refer to these core competencies, aligning digital health skills with them to demonstrate how to incorporate this new knowledge into your daily practice. The competencies are: the first one, to independently diagnose the nursing care required using current theoretical and clinical knowledge and to plan, organize, and implement nursing care. The second one, to work together effectively with other actors in the health sector, including participation in the practical training of health personnel. The third one, to empower individuals, families, and groups towards healthy lifestyles and self-care. The fourth one, to independently initiate life-preserving immediate measures to carry out measures in crisis and disaster situations. The fifth one, to independently give advice to instruct and support persons needing care and their attachment figures. Sixth one, to independently assure the quality of and to evaluate nursing care. The seventh one, to comprehensively communicate professionally and to cooperate with members of other professions in the healthcare sector. And the last one, to analyze the care quality to improve ISO when professional practice as a nurse responsible for general care. According to you, nurses must have a thorough knowledge of the sciences on which general nursing care is based. This includes a sufficient understanding of the structure, physiological functions and behavior of healthy and diseased individuals, as well as the relationship between the state of health and the physical and social environment of human beings. This course will help you gain this comprehensive knowledge in the context of digitalization in healthcare systems, focusing on the relationship between digital tools and the work of frontline nurses. Throughout the course, the exclamation mark will make you aware of how the knowledge in the lesson relates to the 8 core competencies for nurses. The role of nurses in the digitalization process of healthcare ecosystems is essential. Representing the majority of healthcare professionals, nurses need new skills so that they are better prepared not only to face daily challenges, but also to be prepared to face future healthcare challenges. On the other hand, it is necessary to engage the healthcare professionals in the co-creation of the digitalization process so that they can indicate what the healthcare system and frontline nurses really need. In this regard, in an increasingly digitalized and ever-changing world, Upskilling is essential to ensure that new technologies, such as artificial intelligence, develop in the right way for the healthcare sector. In the context of skills, BeWell Project is in line with the general objective of developing lifelong learning that aims to give frontline healthcare workers the new skills necessary to improve their professional level and to better face daily challenges in the future. Once again, co-creation is the key word. Nurses and all healthcare professionals must be involved in the digitalization process from the beginning so the developed skills and tools are beneficial for the entire healthcare ecosystem. Thank you very much for joining this course. Let's begin with the first quiz and move on to the lesson 2, where we will delve into the digital health for nurses.